You know that feeling, right? Like you
Yeah.
encounter a public service or maybe even a product, and despite what seem like good intentions, it just doesn't really work the way it should.
Yeah.
Long queues, delays, sort of band-aid fixes. It's a frustration I think many of us experience, and it often points to deeper systemic issues, things that aren't immediately visible.
It's a classic symptom, really.
Yeah.
The surface problem, might be clear, but the underlying mechanisms that keep it going are often way more complex.
Absolutely. And that brings us directly to Thailand today. Now, Thailand's a country that has made incredible strides with universal health coverage.
Hmm.
They've got systems like Thailand's National Health Security Office, the NHSO, offering free dental services, and also their Social Security Scheme, SSS, with basic benefits. But despite these advances, they're facing this really puzzling challenge: persistent inequity in public dental care.
Yeah, and what's fascinating here and what we're diving into is a presentation from Mahidol University that tackles this very paradox
Yeah.
head on. They use this really powerful tool called causal loop analysis.
Causal loop analysis.
Exactly. To truly expose the hidden dynamics and what they call feedback structures,
Hmm.
basically how different bits of the system continuously influence and, well, reinforce each other. They create these cycles of behavior that just perpetuate the inequities.
Ah, okay.
So our mission today is really to unpack these insights, to try and understand why a system that's actually designed for equity can still end up producing these inequitable results.
It's like finding the hidden code that makes the problem loop over and over instead of just seeing the error message pop up.
Precisely.
And speaking of policies, they even mentioned something called the 1ID model for free private dental care. Now, that sounds like a pretty straightforward solution on the surface,
It does.
but the research suggests it might actually be overlooking some, key systemic bottlenecks. So what is going on under the surface here?
Well, like you said, Thailand has made really significant strides with its universal coverage. You've got the NHSO providing free dental services, the SSS offering basic benefits, albeit with a copayment.
Right.
Yet the visible symptoms of inequity, they're just undeniable.
Mhm.
Long queues, delayed care. And this hits vulnerable populations particularly hard. These aren't just, inconveniences. They're critical barriers to getting necessary treatment.
So how did this research go beyond just seeing those symptoms? How did they manage to figure out the underlying why? What was driving it?
Yeah, they asked a really crucial question. What dynamics sustain these service barriers? And maybe more importantly, how do they reinforce inequity? To answer that, they used a mixed method design.
Mixed methods, so numbers and stories.
Exactly. Quantitative analysis of claims data, provider data, plus extensive community surveys, and really crucial in-depth interviews. They spoke with 48 community members and 27 dental providers.
Wow.
Yeah, gathering a truly grounded, real-world perspective on what it's actually like.
That qualitative data, the interviews, that sounds absolutely critical. Did any specific insights from those conversations really shift how the researchers saw things or challenge their initial ideas?
Oh, absolutely. Those insights were fundamental in shaping their causal loop diagrams. They grounded everything in Live Access framework, which is a well-known model for understanding all the different facets of healthcare access, beyond just, is there a clinic nearby?
Okay.
And these findings were then synthesized into 6 interconnected causal loop diagrams. And these really reveal the complex interplay of forces that are at work.
All right, this is where it gets really juicy as we start to map out the system's inner workings. Let's start with loop number 1, the growth and underinvestment trap. What's the core dynamic there?
Okay, so this loop shows a really fundamental imbalance. The NHSO's free dental benefits, great for improving access, right?
Right.
But they simultaneously drive up demand a lot.
Makes sense. Free services usually do.
Right, but the problem is public capacity. So the number of dentists, clinics, equipment, all that, it just lags behind. It hasn't kept pace.
So demand shoots up, capacity stays flat. Is that purely a funding problem, or are there deeper, maybe structural reasons why public capacity can't keep up?
Well, it's more than just a lack of funds, although that's part of it. It's really a systemic trap. The key insight from Loop 1 is that unmanaged success can actually become a trap.
Unmanaged success.
Yeah, when a really beneficial policy like free care rapidly increases demand, but you don't proportionally increase capacity, the system gets stuck. It's always just catching up. It never really gets ahead or serves its purpose efficiently. Demand consistently outpaces this sort of static supply, and the queues just keep growing.
Okay, so with queues growing like that, the obvious next step for policymakers is probably to try and manage them somehow, right?
Yeah.
Which I guess brings us to loop 2, the illusion of queue management.
That's right, yeah. When faced with these growing queues, the initial reaction is often these symptom-focused fixes, things like implementing appointment systems.
Seems logical.
It does. And they might offer some temporary relief, maybe smooth things out a bit day to day, but they fail to address the underlying structural inefficiencies that are actually causing the queues in the first place. So the result is the queue, despite all the management efforts, it just persists. It doesn't really go away.
So it gives you this false sense of progress. Wow, that's a powerful realization, isn't it? That managing a symptom can actually prevent us from seeing or maybe dealing with the underlying disease.
Indeed. And those persistent queues, they have a very direct impact.
Mm.
Which brings us neatly to loop 3, barriers for vulnerable groups.
I can imagine. I mean, long queues are a hassle for anyone, but for certain groups, it must feel like an insurmountable obstacle sometimes.
Precisely. Long, unpredictable queues, they significantly reduce the chance for same-day access to service. You can't just walk in and be seen easily.
Right.
And for vulnerable groups, this unpredictable access translates directly into increased indirect costs.
Indirect costs, like what?
Well, think about travel expenses, maybe multiple trips if you can't get seen. Lost wages from taking time off work, often unpaid time for these groups, or arranging childcare. Even when the dental benefits themselves are free, these indirect costs pile up and become really substantial.
It really makes you rethink what free truly means in this context. I mean, we've probably all experienced a free service that ended up costing us hours of time or unexpected expenses, right? But for vulnerable groups, those hidden costs aren't just an inconvenience, are they? They're potentially a complete barrier pushing them to just opt out of care altogether.
Yeah.
That fundamentally impacts equity, doesn't it?
It absolutely does. Loop 3 highlights this crucial principle. True accessibility goes way beyond just the direct cost. If a system imposes significant hidden burdens like time, travel, lost wages, these indirect costs can disproportionately exclude vulnerable populations, and that fundamentally undermines the whole goal of universal access.
Okay, so if the public system is strained like this, with queues and this underinvestment trap, what's a common strategy governments might try? Loop 4 seems to delve into this idea of shifting burden to the private sector. And this is where things get really interesting, with unintended consequences.
Yeah, the One ID policy is prime example here. The NHSO started purchasing services from private providers. The idea was to relieve the overload on the public facilities.
Okay, seems reasonable. Take some pressure off.
On the surface, yeah, it looks like a straightforward balancing loop, trying to alleviate the public burden.
But I sense a but coming.
There's a critical insight, yes. The but is this. If this policy isn't managed very carefully, it can inadvertently reallocate the budget away from public providers.
Ah, wait, how?
Well, the money follows the service. If more services are paid for in the private sector, less budget might remain or be allocated for strengthening the public sector itself. So what starts as a way to relieve the public system could actually become a reinforcing loop that weakens long-term public capacity. It does this by diverting essential resources.
Wow.
It's a paradox, really. A well-intentioned policy aiming to help, but if it's not carefully managed, it can inadvertently undermine the very public system it's supposed to support.
So you're trying to help, but you might end up kind of eroding the public system itself from within. That's truly fascinating and a bit scary.
It is. It highlights the need for really careful policy design.
Okay, moving on to loop 5, dental care business dynamics. This must be about how the private sector itself behaves in this ecosystem.
Exactly. The research shows pretty clearly that private clinic participation is highly sensitive to the reimbursement rates they receive.
Makes sense. Money talks.
It does. When these rates are low, private clinics are just less likely to participate in the scheme. So access through the private sector shrinks. Conversely, if you raise the rates, more clinics are willing to join.
So provider behavior, especially in the private sector, is really acutely sensitive to those financial incentives.
Absolutely. And that directly impacts the overall availability of services under the scheme.
So the market dynamics play a huge role in who provides care and where, which I guess leads us to the final piece of this puzzle, loop 6, fragmented payment models. What's the specific issue here? Is it just too complicated?
It's about the different payment models existing within the universal coverage system itself. Specifically, they look at the SSS co-payment model versus the UCS flat rate models.
Okay, different ways of paying providers depending on the patient's insurance.
Exactly. And these fragmented models lead providers to, well, specialize. Or, more critically, sometimes just avoid unfamiliar schemes altogether because they're not really incentivized to handle multiple complex systems. It's easier to stick with what you know.
And what's the consequence then if providers start avoiding certain schemes?
Well, that in turn reinforces unequal access based purely on what type of insurance the patient has. So what this all means is that even when you have universal coverage on paper, if the payment mechanisms aren't harmonized, they can accidentally create new access barriers.
Hmm.
And they reinforce inequities, despite the whole system's overarching goal being equity.
Okay, so bringing all six of these loops together, it's not just a list of separate problems, is it? It's more like watching a complex machine, and instead of just one gear breaking, you realize it's how all the gears are connected and interacting that's causing the systemic issue.
Precisely. That's the power of this analysis.
Yeah.
These loops don't just describe the system. They really expose its underlying mechanics. The core insight, when you put it all together, is that fragmented governance,
Yeah.
these inconsistent financial incentives we talked about, and also a neglect of the user experience. Remember those indirect costs.
Yeah.
They all feed into this self-reinforcing cycle of inefficiency. It's not one isolated problem you can just fix. It's this complex interplay of forces that keeps the system kind of stuck in these patterns.
And understanding those feedback loops is the key, really, to untangling it. This whole deep dive into Thailand's public dental care system, it really highlights the power of this causal loop analysis, how it can reveal the ways even well-intentioned systems get stuck in patterns of inequity because of these hidden interconnected dynamics. It
Yeah.
feels like a powerful lesson in systems thinking that goes way beyond just dentistry.
It really is. And it suggests that systemic change in this kind of context isn't about simple fixes or just one magic policy bullet.
Right.
It requires what the researchers called adaptive policy tools, harmonized payment structures, and feedback-driven learning. It's really about designing systems that can actually learn and adapt over time, rather than systems that just unwittingly perpetuate their own problems.
That's a really profound thought. What might it look like, to apply this kind of deep dive analysis to other systems we maybe take for granted? Things like education or environmental policy. To truly understand their hidden dynamics makes you wonder how many band-aid fixes we're applying out there instead of really understanding the full interconnected machine.